Imagine if the next step toward better health wasn't another prescription but the humble white box on your kitchen shelf. Today, I'm Dr. Samantha Lee, and I've spent over 20 years studying human health from molecular research to bedside care. In the next 10 minutes, I'll guide you through 12 hidden ways baking soda water can transform your health and exactly how to use it safely. Trust me, by the end, you'll never look at that little baking soda box the same way again. Why baking soda? You know baking soda as the pinch that makes cakes rise, but it's actually sodium bicarbonate, a powerful alkaline buffer. In clinical research and real-world cases, adjusting pH even slightly can influence inflammation, cellular function, and symptom relief. Let's explore the science behind each benefit balanced with caution. Gout symptom relief. Gout strikes when uric acid crystals accumulate in your joints, causing sudden, excruciating pain often in the big toe or knee. In a 2024 study in the British Journal of Hospital Medicine, patients who added baking soda water to standard gout treatments saw a 25% greater drop in serum uric acid over 8 weeks compared to controls, and reported fewer flare UPS. Smith et al., 2024. Mechanism: baking soda raises blood and urine pH, keeping uric acid dissolved so it doesn't form painful crystals. How to use: mix 1/2 teaspoon of baking soda in 200 ml water once daily, but only under your doctor's guidance if you have high blood pressure or kidney concerns. Supporting your body's pH balance. Our cells thrive within a narrow pH range, 7.35, 7.45. Diets high in processed foods, stress, and inactivity push us toward acidosis, contributing to fatigue, inflammation, and chronic illness. A 2024 trial in the Journal of Nutritional Biochemistry demonstrated that participants drinking bicarbonate-rich mineral water daily improved their urinary pH and reported 20% more energy at 4 weeks. Garcia et al., 2024. Tip: baking soda water can serve as a reset after an indulgent meal, but it isn't a substitute for a veggie-rich diet and regular exercise. Bouncing back from workouts. Delayed onset muscle soreness, DOMS, sets in 24-48 hours after intense exercise, slowing progress. Baking soda's alkalinity buffers lactic acid, easing inflammation. Evidence, in Frontiers in Nutrition, 2023, athletes who consumed baking soda before exercise reported 30% less soreness and faster recovery. Lee and Patel, 2023. Practical use: take 1/2 teaspoon in water about 60 minutes pre-workout or immediately after to leverage that buffering effect. Natural antacid for digestive comfort. Acid reflux and indigestion become more common with age. Over-the-counter antacids can work, but baking soda water acts instantly, neutralizing excess gastric acid. The American Journal of Gastroenterology confirms sodium bicarbonate's rapid antacid action, comparable to low-dose OTC formulas. Usage: sip slowly on 1/2 teaspoon in water at the first sign of heartburn. Do not exceed 1 dose per day without medical approval. A complementary player in cancer care. Emerging preclinical research suggests tumors thrive in acidic microenvironments. By alkalinizing the area around tumors, baking soda may enhance chemotherapy effectiveness in animal models. Note of caution: this is not a cure. All patients should continue evidence-based cancer treatments. Discuss any adjunctive use with your oncologist. Soothing mouth and throat rinses. Canker sores, mild throat irritations, or post-dental procedure discomfort can be calmed with a gentle baking soda rinse. Protocol: dissolve 1/2 teaspoon in 200 ml warm water. Swish for 30 seconds, twice daily. Benefit: alkalinity neutralizes irritating acids and inhibits harmful bacteria. Patients report faster healing and less pain. Skin relief with a baking soda bath. Eczema, insect bites, and sunburns respond well to a lukewarm baking soda soak. DIY spot: add 1-2 cups of baking soda to a standard bathtub. Soak for 15-20 minutes. Result: many seniors note immediate itch relief and reduced redness. Just avoid if you have open wounds or extremely sensitive skin. Quick heartburn rescue. Frequent heartburn can signal GERD. For an occasional flare, drinking baking soda water brings fast comfort. A 2022 BMJ open gastroenterologist study showed marked symptom reduction within 5 minutes of ingestion. Reminder: persistent reflux demands medical evaluation. Kidney health and metabolic acidosis. Chronic kidney disease patients often develop metabolic acidosis, accelerating decline. In a 2021 meta-analysis, Frontiers in Pharmacology, CKD patients using sodium bicarbonate experienced slower GFR loss over 12 months. Medical oversight required. Never self-prescribe. Your nephrologist must tailor dosage to avoid sodium overload. Battling UTIs naturally. Acidic urine fosters bacterial growth. Baking soda water raises urinary pH, making UTIs less hospitable. Women in a 2017 International Urogynecology Journal trial reported fewer painful symptoms and urgency after bicarbonate supplementation. Important: this approach is supportive only. Antibiotics remain first-line therapy for significant infections. Fresh breath and oral health booster. Bad breath often stems from excess acidity and bacterial overgrowth in the mouth. A baking soda rinse helps rebalance pH and reduce odor-causing bacteria. Study: a 2008 Journal of Clinical Dentistry trial found baking soda rinses improved oral pH and breath freshness more effectively than water alone. Everyday tip: use weekly after acidic meals for an extra freshness boost. How to prepare and use baking soda water. Measure carefully: 1/2 teaspoon, 2.5 g, of baking soda in 200 ml room temperature water. Mix thoroughly, stir until fully dissolved, no gritty particles. Timing: best on an empty stomach, first thing in the morning or 2+ hours post-meal. Frequency: occasional use only, no more than 3-4 times per week, unless directed by your physician. Let's meet Mr. Harold Jenkins, 68, from Ohio. According to an ABC News report, 2024, Mr. Jenkins struggled with gout flare UPS every winter. Under his rheumatologist's advice, he added 1 glass of baking soda water 1/2 teaspoon in 200 ml every morning. Within 6 weeks, his serum uric acid level fell by 15%, and he enjoyed twice as many gout-free days compared to the previous year. No serious side effects, just better mobility and less pain. Safety precautions and when to avoid. High sodium risk: people with hypertension, heart failure, or advanced kidney disease must consult a physician. Drug interactions: baking soda can alter absorption of certain medications, e.g., tetracyclines, digoxin. Always check with your pharmacist or doctor. Listen to your body. If you experience bloating, nausea, or irregular heartbeat, stop use and seek medical advice. Baking soda water isn't a miracle cure, but it's a versatile, science-backed tool that can relieve gout and heartburn, support workout recovery, soothe the skin, mouth, and urinary irritation, complement kidney and cancer therapies. Used wisely and under medical guidance, this simple kitchen staple can become a valuable part of your healthy aging toolkit. Have you tried baking soda water for any of these benefits? Share your experience or questions in the comments below. If you found this guide helpful, hit like, subscribe, and ring the bell so you never miss our weekly tips for living your healthiest, most vibrant life. I'm Dr. Samantha Lee. Thanks for watching, and here's to your well-being.